Today I would like to persuade and prove that U.S. hospitals and medical facilities should share electronic information or medical records with one another. What are online medical records? They are electronic medical records. They're a person's medical records on computer. They are a person's history or current health status. According to the Healthcare Information and Management Systems Society, as reported in the book by Fultz and Lankish, the EHR, Electronic Health Record, is a longitudinal electronic record of patient health information produced by encounters in one or more care settings. The EHR system automates and streamlines the clinician's workflow. It has the ability to independently generate a complete record of a clinical patient encounter and process sufficient data granularity to support clinical decision support, quality management, and clinical reporting, and interoperability. Longitudinal indicates that a patient's EHR will continue to develop over the course of care. Every medical event and document can be assessed within the EHR, regardless of the facility, the country, or the time period. Don't you want all of your medical records easily accessible when you are having a medical event? What if you can't remember your lab results? Or you're in a car accident and you can't speak for yourself? Or maybe you're with your parents or siblings and they don't remember their daily medications. And you don't know them either. Time is of the essence in a lot of medical situations. What if you have a throbbing headache and you're waiting and waiting and waiting? Or you're not the priority because you only have a headache. You're not bleeding to death or dying from a heart issue. If the emergency medical personnel already had your medical information, you would be able to be quickly treated in that situation. It would be quicker, safer, and you wouldn't have any repeated labs, or you also wouldn't have any additional costs. The patient's continuum of care, the patient's safety. It prevents extra costs, like I said, in tests and fees. It helps patients when you're traveling and you don't haul all your medical records with you. It also IDs frequent flyers, which are people that abuse the healthcare system. Allowing hospitals to share information saves money and time for hospitals. In Exploring Electronic Health Records by Darlene Fultz and Karen Lankish, improved documentation, streamlined and rapid communication, and immediate and improved access to patient information. Not to mention increased facility efficiency, improved patient outcomes, and a healthier population. Not allowing the sharing of your medical information, you'll spend more money. You may delay your possible emergent treatment for yourself, and you might have a poor health outcome. According to Dan Gorstein, more than 96% of hospitals are digitized. The image structure on the promise of information sharing is there, so why not go ahead and do it? A study reported by Mark Brohan in 2018 says less than 1/3, or 29.7% of hospitals are sharing, sending, and receiving electronic patient records. Reasons for sharing do outweigh the reasons for not sharing the medical records. It provides a complete picture of a patient's past and current health status. It improves patient outcomes, and again, a healthier population. We need more facilities communicating with each other. Billions have been spent by the government to help healthcare facilities adopt electronic health records. In-network facilities communicate, and there's patient portals. ER studies prove hospitals sharing information save patients from additional scans. The University of Michigan study notes patients were 59% less likely to have a redundant CT scan when both their emergency visits were at hospitals that shared the information. Other tests and percentages were also performed during that study. Rates of repeat scanning were higher when hospitals don't share the information. In an article written by Peter Lucas in 2017 revealed that 72% of patients believe that their doctors could already easily share and access important information online about their medical history whenever and wherever they needed it. In conclusion, present computer technology and capabilities are there to share your medical information. For healthcare to improve, to cut costs, and to save time are all good reasons for hospitals to share health records. A patient's continuum of care, improved outcome, patient safety, decreased cost, less radiation exposure, and more efficient treatment are all positive outcomes to hospitals sharing patient medical records. Thank you.